Recent data by Statistics Korea say the life expectancy of Korean babies born in 2021 reached 83.6 years, hovering above the average of the 38 member states of the Organization for Economic Cooperation and Development. So what is behind the longer life expectancy? How are medical experts seeking to maintain it? And why is Korea facing a severe shortage of pediatricians? Welcome to Issues and Insiders. Today we address Korea's improving life expectancy and efforts to maintain this trend. For more on that, I have Professor Kim Moon Kyu from Yonsei University here in the studio. Professor Kim, welcome back and Happy New Year.
Thank you for having me.
I also have Dr. Alice Tan at MizMedi Women's Hospital live on the line. Dr. Tan, it's a pleasure to see you again.
Thank you for having me.
Professor Kim, we'll start here in the studio. Let's begin then with your thoughts on the improvement in life expectancy for Korea that now stands at 83.6. What do you believe is behind this improvement?
There should be a lot of reasons, but first I would like to mention about the health promotion through prevention of serious illness and more physical activities recommended among population. And people now aware of their weight, and they try to control their weight in a more healthy numbers. And also, we have a very good program to detect cancer in a very early stage. I would like to say that one of my friends had a routine physical checkup, but he refused to do that for many years. And last year, he decided to do the first physical checkup, and he found a kidney cancer by accident. So it was in the early stage, so he removed his kidney and now it's surviving in a healthy condition. So that kind of program is really improving life expectancy. And even though you get some serious illnesses such as cancer or diabetes or whatever, now we have more and more new drugs. Sometimes they cure it. Sometimes they don't cure it, but you can live with the disease. For example, if you have a cancer, you cannot remove it by chemotherapy, operation, or radiotherapy. But the drugs can suppress the cancer cells, even though it doesn't disappear. So you can live with cancer. So this kind of new medications also prolong our life expectancy with good quality of life. So including all of these, we have to maintain the mother and child health indicators in a very good situation. So that in conclusion, we have improved the life expectancy in 2022.
Right, I see. And Dr. Dan, the life expectancy for Korean men stands at 80.6, while that for women stands at 86.6. And that being said, how do you explain the general gender discrepancy, so to speak, in life expectancy, regardless, of course, of country?
Right. So this is a universal finding. Women outlive men throughout the world. If we look at social factors, it would seem that this doesn't make sense because women are socially disadvantaged in almost every society. They face more social inequity. So I think it has to do with biological factors and also behavioral factors. In terms of biology, women secrete the female hormone estrogen, and there's a theory that estrogen may have a protective effect on our cardiovascular system, so our heart and our blood vessels. And this is supported by the fact that after menopause, when estrogen levels decrease, heart disease and stroke, cardiovascular disease rates go up in women. The other factors may have to do with behavior. So women seem to assess their health situations earlier, and they take action in terms of healthy behavior faster than men. Men tend to delay, just as Professor Kim was saying, men tend to delay seeking treatment. They delay adherence to treatment, and they may delay going in for preventative checks, whereas women tend to be more proactive. Also, in terms of risk assessment, women consistently overestimate risk, whereas men consistently underestimate risk. And so men are more prone to engage in risky behavior, such as speeding when they drive. And so they are more prone to get into accidents. And then in terms of substance abuse, men engage in substance abuse much more than women. And finally, the suicide rates for adults, for men, is twice as high than it is for women. So these are all behavioral factors that could affect life expectancy.
Right, I see. And Professor Kim, as you mentioned earlier, life expectancy here in the country is very closely related to cancer, which continues to be a leading cause of death here in the country. That being said, what makes cancer so common here in the country?
People might think that Koreans used to have cancer for a long time, but I would like to turn the clock about 100 years ago. And you know that there was a Christmas seal printed by the Korean Tuberculosis Association. That was first started by Dr. Shode Hall, who was a medical doctor who came to Korea as a missionary. And he was especially concerned about tuberculosis because at that time, 1 out of 5 Koreans died of tuberculosis. At that time, you know, cancer was not the most common cause of death. Anyway, so he was trained in the United States. He came to Korea and he watched the Koreans' disease. And he used to say that Koreans do not die of cancer. They die of infectious disease. Western people, they have cancer, but Koreans, they don't have it. He had an observation that it's very rare to find a Korean having cancer. You know, there was a Korean word, 폐병. Literally means lung disease. All of that means tuberculosis. So I would say that Koreans used to have a poor nutrition, high tuberculosis prevalence. So people just die of tuberculosis. But in 2021, we have a data that in Korea, cancer is the most common disease, followed by heart disease, pneumonia, and etc. Out of 10,000 Koreans, about 16 died of cancer in 2021. So quite a huge number. So why is that? Something has changed during that 100 years of time. I think the food has changed and we have more pollution and the environment has changed and also the human behavior, just as Dr. Dan mentioned. And usually there's no single cause to develop cancer. Scholars believe that it's kind of a multi-step, multiple exposures of carcinogenesis, so that it concludes in cancer sometime in our life, usually in the elderly. And if you have a family member who had cancer, those family members should be more concerned about health.
Right, I see. And staying with that, Dr. Dandan, simply speaking, what do you believe are the causes, perhaps, or some causes behind cancer, and are there ways to prevent it?
Oh, absolutely. There are ways to prevent cancer, but just an oversimplified explanation of what cancer is basically if you have a certain cell in your body that is growing too much or is growing where it shouldn't be, that is kind of how we define cancer. Every cell in our body has signals that tells it to grow and divide, and then signals that tell the cell to stop growing. And basically in cancer, it's one of the two or both mechanisms. In other words, the signals telling the cell to grow are uncontrolled, and so there's uncontrolled growth. And then the signals that tell the cell to stop growing, to sort of put on the brakes, those signals are absent. And so we have an overgrowth of these cells. And of course, if they spread, metastasize, they can go to other places in the body and just not behave like normal cells do. In terms of prevention, lifestyle modification, eliminating toxins, also genetic screening for people who have a high risk of hereditary cancers. These are all ways of preventing cancer. In terms of the toxins, smoking, of course, is one of the well-known toxins. There are also infectious sources that can lead to cancer. Hepatitis B, for example, human papillomavirus can lead to cervical cancer. Hepatitis B leads to liver cancer. And so there are many ways that we can prevent cancer from the beginning just by maintaining a healthy lifestyle and maintaining the recommended preventative schedules.
Right, such as, of course, going to get a test as your friend did, Professor Kim. Moving forward, Professor Kim, some people say that a tangible decline in child mortality itself has led to an overall boost in life expectancy. What do you say?
Yeah, that's definitely true. You can find an early cancer in adulthood, and he will expand his life for maybe 10 years or 20 years. But if you have a good treatment for a newborn baby to let him survive without disease, it's going to prolong the life for 50 years, 60 years, or even longer. So that gives a huge impact on the life expectancy. We can find that kind of phenomenon in the underdeveloped countries, that the first number one target to improve public health is to improve the survival of newborn babies. And usually the data results in a huge improvement in life expectancy. Usually this kind of improvement comes with the improvement in other age groups' life expectancy, and the quality of life also improves for the children. That is also a result of those efforts. So yeah, we have to maintain this good system, and if there's any challenge against this kind of situation, we have to be alerted and reacted very actively.
Right, I see. And also, Professor Kim, staying with healthcare for children, it has been reported that pediatric ER services for children are in short supply here in Korea. As a pediatrician yourself at the emergency room, how do you explain this very unfortunate reality?
Well, I would like to turn the clock to 2020, and there was already a shortage of pediatricians in regional hospitals. But in an institution that I'm working for, we had enough residents coming for training, but we were expecting something's going to do. We have to do something within 5 years or 10 years or something. But because of this pandemic, everything just came at once within a year. And also there's some population decline, and COVID-19 gave us a totally huge change in the pediatric clinics. I mean, we wear masks, we wash hands, we keep distancing. So about 70% of pediatric disease are infectious disease. So just COVID-19 and the other kinds of infectious disease just disappeared. Influenza disappeared and everything. So that resulted in a huge decline in candidates who would be trained in pediatrics. If you have heard the news from University Hospital in Incheon, they gave up caring for admitted patients. You know, if you look at their manpower, they have only 5 pediatricians in the hospital, all of them professors. So they have to do the outpatient clinic, they have to care for the admitted patients, they have to care for the emergency room. So it's impossible for 5 persons to take care of all those jobs. So they decided to close their admission wards, but now they started trying to maintain it as minimal as they can. But this is the real situation. You cannot maintain that kind of jobs in a few manpower. And the pediatric emergency service is also affected. Only about 40% of the university hospitals are maintaining their pediatric emergency rooms, working around 24 hours a day. So if a patient gets sick, if a child gets sick in a regional area, and the patient wants to visit the emergency department, they have to go a very far distance to a big city such as Busan or Daegu. They only have one hospital maintaining 24 hours service. So that's the situation right now. And if you have to take care of critical cases, the situation is more worse.
Right, I see. And before we talk about efforts to deal with that problem, Dr. Dan, is this shortage of pediatricians or of physicians in general, is this a phenomenon seen elsewhere across the world, or is it only here in Korea?
Well, the WHO, they have a metric called physician density, and that's how many physicians or doctors are in a country per 1,000 population. The world average is 1.7. And the WHO, they have a threshold of 2.3 in terms of we need at least 2.3 physicians per 1,000 population in order to maintain just the basics of primary care for the population. South Korea is at 2.4, Japan is at 2.5, China is at 2.2. There are many countries in Southeast Asia, Central Asia, and in Africa where the physician density is less than 1. And so this is certainly not a problem unique to Korea. Many countries around the world have doctor shortages. And unfortunately, what we know is this physician density number can directly correlate with life expectancy. So when you have a shortage of physicians, that can severely affect the quality and also the length of life that people are able to enjoy.
Right, and that being said, Professor Kim, what do you now propose perhaps to address the shortage of pediatricians here on the local front?
Yeah, I'm very sad to say that young doctors, sometimes they give up training, they just go to their private clinic, and they're reluctant to get trained in a hardworking overnight duties and critical care service. So I wish that we can change our medical system. I mean, increase the medical fees for children, especially who have to take care for critical cases and admitted cases. And we need government support for pediatric resident training programs, such as we have in general surgery or chest surgery. And government support is also needed in a pediatric hospitalist who take care of patients who are in hospital. And also government support for pediatric emergency care service. Our institution now joined that program, so we can hire more doctors, but still we are in need. And sometimes we cannot find a candidate who are willing to take care of pediatric patients. So and in that case, we need to hire a nurse practitioner, so specialized in pediatrics. So they are not the doctors, but they are a big help for pediatricians. So I wish that we can have a support for that. Every year, every hospital is on evaluation, whether they are qualified or not. So I wish that during that qualification process, I wish the government can give a favor for hospitals who are maintaining pediatric critical care service and emergency departments. And now we have a system that we can charge the patient, and the more patients you see, you have more income. But I wish we can change that to the time we have to put for the patients. For example, we have a simple test for adults and for children. You can do a simple test for adults very easily, but sometimes it might take 5 more times to get the proper result for children. Because
they might cry, they might be uncomfortable.
Yeah, we have to sedate, and a lot of things have to do. Sometimes we need more personnel. So we should have a different charging system. And I wish that the government make a special department taking care of these pediatric issues, so we can tackle all these huge issues very efficiently.
I see. So essentially speaking, the government's plans to perhaps boost fertility here in the country should really start with healthcare options or services, that is, for children themselves here in the country.
Yes.
Also on the local front, Dr. Dan, pundits claim Korea's healthcare system, as efficient as it is, places quite a lot of priority on treatment itself, while prevention is put on the back burner. What are your thoughts?
You know, I would agree and disagree with that statement. I disagree with that because the Korean national health insurance system that we have here requires people to undergo routine cancer screening for the top 5 cancers. So that would be cervical cancer, breast cancer, liver cancer, stomach cancer, and colon cancer. And so everyone, we have universal health insurance in our country, everyone who has health insurance, national health insurance, they're required to undergo cancer screening. And this is, of course, a preventative measure. We also check for high blood pressure and diabetes as part of national health screening. So in that respect, I think Korea is doing a very good job. However, on the other side, a lot of preventative medicine involves education, and that takes time. Listening and talking with the patient, sometimes it has to be done over multiple episodes. And the reimbursement scheme for this type of education it isn't very favorable for hospitals to hire the staff to do this kind of education that's needed. And so I think in terms of reimbursement, it's worth any third-party payer to invest in preventative medicine, including education, because you will get your return on investment if you prevent severe diseases from happening through prevention.
Right, and as Dr. Dan has mentioned, Professor Kim, prevention is better than cure, of course. And that being said, we have like about a minute left. Professor Kim, to ensure health in the year 2023, what do you recommend?
Well, there was a British physiologist and nutritionist named John Yotkin. He wrote a book named Pure, White and Deadly in 1972. So do you know what it means? Pure, white, deadly means a sugar. And we should avoid sugar as much as we can, and also high fructose corn syrup. These kinds of things are really bad for health, though. So in this year, I think we should have minimal sugar as possible. Also quit smoking and minimize alcohol, or even quit alcohol as much as you can.
Right, I see. So cutting down on sugar is going to be on my New Year's resolution this year. Professor Kim, as always, thank you very much for your time and your thoughts. And Dr. Dan, thank you so much for your insight today.
Thank you.
Right, well, that is all the time we have today. We return with yet another edition of Issues and Insight at the same time tomorrow. That is Friday. Join us then.